Hello, guys. I'm Dr. Del Santos, third year podiatry resident. We're going to be starting our live event with our fourth student leader, Mr. Aaron. He's from Temple University. So, how you doing, Aaron? See if we can get you set up. And we're going to talk about mostly about podiatry life as a student. All
Hey, how's
righty.
it going? Yeah, sorry about that. Technical difficulties.
No worries, Aaron. So, how's everything going, man? How's third year, right?
Yeah, third year. It's going well so far. I mean, right now, pretty much just in the clinic, we're all done with our classwork and stuff. So we have academic sessions virtually now too, but right now it's mainly in the clinic and starting to get ready for externships.
Cool. So you're in, where do you live in Philadelphia? Are you back in Philly?
Yeah, I'm in Philadelphia. I'm like a block off the TUSPM campus, so Chinatown in Philadelphia. So it's a great area. A lot of
So
good
I
food.
I talked to a second year, Miss Hannah this morning. She's saying that you're getting a feet of snow. Is that
Yeah,
true?
no, it's coming in right now. It's gonna be bad. So I've heard a lot of different ranges, but we'll see how it actually falls down. They were prepping the sidewalks and everything earlier, so hopefully that helps a bit. But they already closed the campus tomorrow, so
Awesome, awesome. Alrighty. Huge favor, Aaron. Is there any way you can adjust the camera so the light on the back doesn't just tilt it down maybe a little bit? Yeah, that's perfect.
is that better?
All right.
Okay, good.
Yeah, that's awesome. All right, so we're just gonna get started. We're gonna start with some general questions, and
Sure.
then ask you like the specific ones that I sent you. But I think you're pro at this, and we already done this before. So, why did you chose podiatry?
So initially, I went through undergrad. Wanted to go into the medical field, but initially I was only really looking at the MDDO route. And I was actually on a medical missions trip late my sophomore year, and in one of the villages we were in Honduras, it was kind of like a wound ward. Like there were just diabetic wounds, venous stasis ulcers, all kinds of different wounds I'd never seen before. And when I got back to the US, I just kind of started looking into them and found podiatry. And it was actually a perfect fit for me because I played soccer my entire life, had tons of injuries, played in undergrad as well, but never actually saw a podiatrist for them. So once I started researching, did some shadowing, and then went to the Temple winter internship program, everything just kind of fell into place. And really happy that I can kind of mix all um, my interests like wound care, sports medicine, surgery, diabetic care, just overall health in the population. It's a great field to be in.
Awesome. So you're a current third year, correct?
Mm-hmm. Yeah.
So you've taken many classes, seen it all. Is there a
Oh yeah.
favorite class that you have?
Uh, I've taken a lot of great classes, but I think the most unique and just the best experience that I was able to have was in anatomy itself. So general and lower extremity anatomy, just being able to work with the cadavers and having that whole experience. It's a very kind of humbling experience, and just being able to see all the structures that we're actually learning and kind of like preface our way into what a surgical field's going to look like. It's a really unique experience, and I had a great time learning it.
And then, what is your least favorite class? Do you have one?
Uh, I wouldn't say there's any that I disliked. Like I think everything's really prepping me to be the best doctor that I can be. But I think probably one of the hardest classes, just in general for me, was pathology. It's just a bear of a class. I think it was like 9.5 credits almost, and you learn all the pathohistological processes going on, pretty much everything that can go wrong in the human body, all the mutations involved in cancer and everything like that. So it was a really comprehensive course. Um, Definitely a lot of long hours studying there, but definitely learned a lot from it. So really enjoyed it.
Awesome, awesome. What's currently going on in your life? Any big changes or plans coming up? You're about to enter fourth year, so how's that?
Yeah, oh, it's going great. I mean, being in the clinic, I think it's finally seeing the light at the end of the tunnel, I guess, after the long coursework. And um,
Mhm.
so now it's starting to prep for externships, trying to figure out where I want to go for those programs, and kind of what I want to like, set as my goals moving forward. So right now I'm just really doing some research, trying to find the programs that will fit me best individually. Right now I'm thinking I want to lean towards more an academic center that does trauma, just a very well-rounded program so that I can get the most out of it and really tailor my future goals and career as well. So right now doing a lot of prep work, going through the Prism, just trying to read articles, research different programs, and figure out keep my options open and see what falls into place.
And then, are you preparing for midterms? Anything coming up?
No, we're all done with our exams, so I'm no more tests at Temple as of now.
Oh,
Um,
wow.
yeah, right now we're doing academic sessions, but they don't have like an exam component all to them. So we're doing like biomechanics and interdepartmental sessions, just to kind of fill in time that we don't have anymore, not necessarily just because we can't be in clinic as much anymore, but otherwise definitely learning a lot and trying to make the most of it.
And so now as a third year, you have learned what's been the biggest change or the biggest thing you've learned in the past 6 months and now as a third year?
So the first semester of third year, we really did a lot of our more surgical classes. So we had traumatology, we had pediatric orthopedics, reconstructive foot and ankle surgery, first ray. So there were a lot of courses that really starting to transition us into that surgical field and more clinical aspects as well. So that was just an overwhelming amount of information. It was incredible to finally put what we're learning and then being in clinic and actually seeing like post-op from those procedures, kind of bringing it all full circle. I guess it was really cool. I was actually supposed to scrub into a case, but the patient ended up getting COVID, so we had to cancel that. But we have a ambulatory surgical suite right on campus, so
Oh, wow.
that would have been really interesting as well. But I think overall, it's just every day I go into clinic, I come out with something new, just whether it's just a different pathology I hadn't seen before or experienced in person, or just going through like different radiographs, seeing different indications for different surgical procedures or like the post-ops as well, how to manage the patient, just work with the attendings. So
Yeah.
it's a lot, but it's really enjoyable.
What year has been the hardest? First year, second year, or third year?
I think the hardest semester, at least for most Temple students, would say the second year. That's just because there's so many courses that fall second year. We have a very, very dense schedule. And then in the spring leading up to our boards, the Part 1 boards for APMLE. So that's a very, very academic heavy year, a lot of hours just trying to memorize information and get the most out of it. But now that we've transitioned more out of that didactic learning and we're in the clinical setting, we have a lot more, like, I guess, free time. We're not necessarily required to be in classes except for the academic sessions and then in clinic, but that's definitely less than previous years just because of the pandemic and everything. So it's right now we have a lot more free time on our hands, per se, but still trying to be productive during that time and do research and all that as well.
Of course. So tomorrow's going to be Monday. Walk me through a typical day for a Monday morning. What time do you eat, wake up, go to class, work out,
Sure.
go to sleep?
So depending what day we're in clinic, we kind of get paired one-on-one with the clinicians. So this in February, I'll be with Dr. Meyer for 2 or 3 days a week. And so we're split into either morning or academic sessions. In the morning session, we see patients from essentially 8:30 to 12:30. The first patient wave comes in at 8:30 and then 9:30 and 10:30. So pretty much go into clinic around 8 o'clock, eat breakfast before that, shower, get ready. But then once we're in clinic, we're there until we see everyone, finish up all the notes.
Is
After
that
that,
around
just
5 p.m., 6 p.m.?
well, so because we're kind of split right now into the morning and PM sessions, it's like
Okay.
8 to 12:30. We're not allowed to go in like the morning and afternoon shift just because of spacing and everything within the clinic. But if you are in the morning shift, you're typically in there from 8 to 12, 12:30, I would say. And then in the afternoon would be start seeing patients 1:30 and then 2:30 and 3:30. So anywhere from like 1 to 5 for an afternoon session. And then depending on that, we have academics built in the mornings or afternoons so that if you're not currently in clinic, then you can work on those academic sessions as well. But after that, I typically just get something to eat. My roommates and I would love to go to the Planet Fitness right nearby. So it's nice to get out a little bit and get some exercise and go for runs and stuff like that around the area. Otherwise, just pretty much locked down in an apartment. Yeah.
Yeah. So, random question.
Sure.
What are 3 things you cannot live without as a student?
As a student.
Yeah. 3 things.
Well, I have my my bone model. I have my LEA flashcards literally right here. So these are pretty important. And right now, I mean, I'm going through the Prism, so pretty much everything in there. I pretty much am living off of these right now.
Okay. Funny story. So actually, a lot of people study Prism. I even studied it like 4 years ago. That's been passed down from like generations to generations.
It's incredible. Yeah.
Is there Prism Plus? Is that the new one that I heard? I think it's just Prism, but that's been updated. It's called Prism and has a plus sign.
I don't have that version, so I will have to keep an eye out for that.
And the guy who wrote that, I believe at the very beginning or at the very end, he includes a small biography and his actual email and all that, if I remember.
Actually, it's Dr. Meyer, so that's who the clinician I'll be working with this whole month. So,
yeah. All right. So I actually met him. Obviously, when you read Prism and study it, it's like the holy grail as a student. And then I didn't know who he was, and then I saw him at an ACFAS conference. I was like, oh, snap, he wrote Prism. Like, it
all clicked. No, he's incredible. So I'm really excited to work with him because I'll be essentially with him and 2 or 3 other students for the whole month and just kind of picking his brain and trying to get everything I can from him.
Awesome. Actually, is he planning on running anything new with Prism? Do you know? How about you ask him?
I definitely will. Yeah, because it's a great resource. 100%.
All right. Now we're going to get into more specific questions. So how are you preparing for 4th year? We talked a little bit about it, but what advice would you give like an incoming 3rd year? Are you talking to people ahead of you? Is there resources? What are you looking at?
Yeah, I definitely think talking to the upperclassmen and getting their perspective, especially now since I'm about to, we submit our applications for the externship process in April. So at this point, I'm really trying to narrow down what programs I want to apply to and figure that out, because that essentially, for the most part, most people go to residency from one of the places they've externed. I know there's plenty of examples where that's not the case, but I think generally most people go to a residency program from which they externed at. So I really want to find a good fit for me, and I think the best way to do that is to talk with the people who've already been there. Right now it's a little difficult to visit, but if you're able to visit a program or able to join in academic sessions, I highly would recommend that as well. They love to see you and just involve you in their discussions and just to kind of show your interest to the program as well. So I think that if possible, I know it's difficult now, but I would definitely recommend visiting or talking with upperclassmen, just talking with the clinicians and attendings at the different programs and reading articles that they've published, all kinds of great ways to try to figure out what that program kind of embodies and what they are interested in.
Yeah. How many months do you have externships at your school at Temple University?
So we will have externships from June through January, and then we have one base month where we're required to be back at Temple. So the other, typically you do 6 externships.
What's the difference between an intern and an extern? Let's say I'm for a high school student. How can you explain the difference?
Yeah, so the externs, we pretty much go out to the different programs. They're essentially like month-long interviews, just working at the different programs as students and really trying to learn and figure out um, like how to work in a hospital setting or within that program itself. And the intern year, so like the first year resident, is once you're actually there and working in that as a full doctor and talking with like all the students and the attendings, just making sure like, at that point you pretty much have autonomy and you're really, working as a
Yeah.
doctor.
And then, so I know you're looking for an overall well program, but how far are you willing to travel for that? Or is the location a big thing? The number of residents that they acquire, um, boards, passing rate? What are your top two things, just to pick your brain?
For me, I think personally, if the program's the right fit for me, I would be willing to travel for it. Um, that's one thing I'm still trying to kind of broaden my horizons on right now and figure out if there's a certain region that would be like I'm from the Northeast, so generally that's where my programs that I think of are. But talking to my upperclassmen and stuff, I'm trying to kind of expand and see if there's other programs outside that area geographically. But if I do find a program that I really enjoy, then I wouldn't mind traveling out to it. Um, I definitely think like surgical numbers are important as well,
Hmm.
and board pass rates for sure. Like if we're not able to pass the exams, then we're not going to get into one finish the residency and then actually get our licenses and stuff. So I definitely think those are really important. But I think for me personally, just seeing how the different residents are at different stages of their training, how like good their hands are, how well they're able to make their medical decisions. So I think like that's where I'm going to be in 3 or 4 years, depending how which program I go to. So I think having that experience and being able to see kind of a future version of myself at that time, it's a really cool experience.
So, the majority of podiatry residencies, I would say they're 3-year programs,
Yep.
but there's a dozen or a handful that are 4 years.
Mm-hmm.
How do you feel about that? Do you feel like it's good, it's too long, or no, we do need 4-year residency programs?
So at least from the ones that I know about, like I know Temple has a 4-year program, and then University of Pennsylvania has one as well. Um, that fourth year they use really to train you in generally in medicine as a whole. So I think you get kind of like a essentially rather than jump in straight into podiatry, you're also taking a year just really to focus on medicine as a whole and with all the other different specialties as well. And I know every residency, whether you're at 3 or 4 year, you're going on different rotations with different specialties. So no
Yeah.
matter where you go, you're going to find that well-rounded education and training. Um, that's one thing I'm still trying to figure out. Um, if I want to do a 3 versus 4 year program, again, I think the fit for me, if I feel that the program embodies what I want to do and my goals, I wouldn't mind doing that fourth year. But I know like potentially you could do a 3 year program and then do a fellowship afterwards instead of that fourth year at the residency program. So that's definitely an interesting topic to kind of navigate.
Yeah.
And
There's no right or wrong answer. I just want to see what
yeah,
you would think. But
yeah,
look, I'm a current third year. I've
right.
been around the block. I've done plenty of surgery, and I always wanted to do fellowship when I was.
Mm,
But now that I'm in it and out it, I think I'm ready to start my life. Meaning,
yeah,
skip the fellowship and go straight to work, kind of deal. So
yeah,
it all depends on your program overall. So mine was really well rounded, forefoot and rear foot and reconstruction and
okay.
wound care and pediatrics. Luckily, my hospital has a pediatric emergency specific.
That's
So
awesome.
I
Yeah.
got to see a lot of things. Numbers wise, I was able to finish within a year and a half of my residency. So in theory, I could have graduated a year and a half for
Right.
with all my
Yeah, no,
surgery. So that
that's incredible.
so other than after the year and a half, all you do is work on your surgical technique and try to work on your speed. And believe it or
Yep.
not, your third year, the last 6 months, it's like you're trying to find a job. So that's where I'm at
Yep.
right now. So
Yeah,
it's
that's
gonna,
got to be an interesting process, but
yes.
exciting for sure.
So even though it's a 3 year program, the reality it's like a 2.5, and that last half, you're just one, you get senioritis, two, you're trying to get a job, three, you gotta once you get a job, you gotta worry about where to move and where to live. It's
Mhm.
it's actually it's pretty fun. So it's stressful.
Absolutely.
All right,
Well,
last question. What advice would you give to an undergrad or a high school student that's interested in podiatry?
sure. Yeah, I definitely think overall you really want to find um, just a balance of, and really take time to figure out what your goals are. Um, I really only knew about MD or DO programs going in through even almost through the whole way through undergrad. So really take the time to shadow different specialties, figure out what really fits for you and what field you want to go into. But I would say for sure shadowing is huge. Just until you're actually seeing what podiatrists are able to do on a daily basis and the different treatments that they can provide for their patients and the relationships that they build with the patients, I think most people don't really have any idea what podiatrists do. And so I think just better exposing yourself to the field as a whole, trying to read up. I mean, Hawks Magazine and PrePodiatryLife is an amazing resource here. So um, just trying to broaden your horizons. I think if you're able to like medical scribe or volunteer as an EMT or just work like a CNA or something like that to get medical exposure, the more you dive into it, the better the more you'll get out of it going into the profession. Yeah. So I definitely think that shadowing, just researching the different fields, and then just trying to delve into medicine as a whole, it's going to pay off and really help your future patients.
Nice. No, thanks, man. I appreciate you. You're a great student. Actually, every time I mention your name around other Temple students, they know who you are. They think really highly of you. They have nothing but positive things to say. I was like, oh man, finally get to meet Aaron over video. So
Yeah, I'm glad we got to have this time. It was awesome.
and what position you played in soccer?
I was center mid, so
Wait,
a lot of running.
are you short or I guess
Yeah, I'm
you're
only like 5'7". Yeah.
okay. So I'm Mexican, so like soccer is like every Saturday morning with breakfast kind of deal.
Oh yeah. No,
So
it's amazing. A little washed up now, but I loved it for sure.
and then
Try to keep up with it as much as possible.
you had a European team that you root for?
Manchester United's my go-to team. So you have one?
Actually, yeah, Barcelona because I visited the stadium. It's really
Uh,
pretty.
I mean, they're they're just incredible, and Messi's probably the best player of all time. That's my viewpoint. So I grew up watching them, and Xavi and Iniesta. That was my favorite trio of all time.
Nice. Awesome, man. All right.
Yeah,
Thank you for having, and we'll upload the video, but you've been awesome, and I wish you the best of luck, and I'm always here.
yeah.
So,
Thank you as well.
all right.
Best of luck with your job search and everything.
All right, man. Take care. Have a good
Have a
one.
good one. You too.